So one of the most difficult situations that we deal with in medicine is dealing with an emotionally charged or difficult patient. We see this happen all day, every day in all of our practices, whether we're working in the emergency room or we're in the clinic or in the operating room. And I think that approaching this in a way that's healthy and in a way in which both sides feel like their concerns are being addressed is incredibly important. The first thing to remember is that as the physician, you set the example. We set the example for our interaction with patients, we set the example for our trainees, we set the example for society as a whole. And we must hold ourselves to the highest of standards when interacting with situations that really may aggravate us. And the best way to do that, I think, is to really take a step outside of the situation, try to look at it from the patient's perspective first. For example, if a patient is very upset because they've been waiting a long time in the waiting room, I think it's important to first, in your mind, take yourself out of that situation and think, how would you feel if you had been waiting an hour or 2 hours? It doesn't take very long to do that, and I think that really helps to diffuse what could end up being a volatile situation. The second thing that I think is incredibly important in these situations is to talk with a very calm tone. It is very easy and is very natural for us to raise our voice and to get agitated and let our own blood pressures get up, but that doesn't really help the situation at all. Again, as a physician, you have the responsibility to set the example, and I think that it's important to really maintain a calm tone of voice, address the issue, explain how you'll rectify the issue or explain why the issue occurred, and then proceed from there to find a solution. The third thing that I think is incredibly important is to have these interactions in an open space rather than in a closed room. And that might seem a little bit counterintuitive, but the reason that I think that is incredibly important is it creates the sense in that room that the patient is not being closed off. And I think that that's incredibly important for patients to feel that they are in a safe space where they can vent their issues. That usually diffuses the situation by 50%. The other reason that it's incredibly important is it allows both parties a means to exit the situation if things are getting even more hostile or if somebody just needs to take a break. I think it's incredibly important to let people's emotions calm down before there is a very acute interaction, and oftentimes that may happen in the hospital setting. If you're going to a patient's room in the hospital and they're clearly very agitated or the family is very agitated, I think the best thing to do in that situation is to say, everyone is very charged up. I think it's best for us to just stay away from each other for about 10 minutes and then come in and together try to find a solution.